Good morning all. My name is Dr. PJ Madam Rafi. Today we are going to discuss about contraceptives and their types and their indications. Okay. So what are the types of contraceptives we have? We have like oral contraceptive pills, injectable contraceptives, implants or intrauterine devices. Next hormonal contraceptive, that is testosterone and androgenate or gazipol. These are recently developed hormonal contraceptives. So in this main important thing is OC pills and implants and injectable contraceptives. Okay. So in OC pills we'll have types like four, that is combinational pills. Here we'll have combination like estrogen and progesterone pills. So in this thing we'll have monophasic, biphasic and triphasic. What are those we'll see in following slides. Next is mini pill. These are also oral taken drug. Mini pill means it is only contains progesterone, that is also known as progesterone only pill. Here the drug will be norethindrone or norgestrel. Okay, here that will provide only progesterone only. That's why it is a progesterone only pill. Okay. Next is post-coital pill or emergency contraceptive pill or emergency after coital pill. Okay. So it will be taken within 72 hours. That means it is a after immediate, after unprotected coitus, we will use these medications. Okay. Next one is centchromine. Centchromine is also known as armiloxifene. This is an Indian developed drug. Already explained in previous class. That is in CRM it will be there. Centchromine, armiloxifene. It is also known as it is in the name of Saheli. It is distributed all over India through national program. So this drug will be given as a 30 mg twice in a week. Okay, for 3 months. Then after we will go with 1 week, once in a week. Okay. So this is used as a contraceptive. It is mainly developed for DUB, dysfunctional uterine bleeding, but it is also having contraceptive property. Okay. Now that's why we are using in this is main thing is this name Saheli. Okay. Saheli means it is an centchromine warmilexifene. It is an selective estrogen receptor modulator. Okay. SCRM. So we'll see what are the combination pills. So in the combination pills means it will, here we'll have two types, that is three types: monophasic pill, biphasic pill and triphasic pill. It is a combination. Here we have drugs like with combination of estrogen and progesterone. In monophasic means there will be no phasic increase. That means there will be no increase or decrease of estrogen progesterone in this phase. Okay. So that means it is monophase. There will be fixed combination will be given for the 21 days of cycle. That means the first day we will use the drug in the fifth day of menstrual cycle. Okay. Fifth day of cycle we will give, will start the drug and then we will continue for the 21 days. Okay. So in that mainly last 7 drugs in there will be recently added drugs will be there, that are iron supplements will be given the last 7 days. Okay. Now recently they are asking image based. Okay. If the drug will be within 21 days means it will be fixed combination, that is estrogen progesterone combination. Last 7 tablets will be red in color. Okay. That is iron supplements. Okay. Because of the menstruation we will do iron supplements in the last 7 days. Okay. That is in the monophasic pills. Next is biphasic pills. In the biphasic pills, if you see, there will be no alteration in estrogen levels. Okay, there will be only elevation of dose in the progesterone level. That too from, if you see here, 1 to 10 days will give 0.5 mg. After that one will give 1 mg. Okay, that's why it has is a biphasic. That means one phase will give same dose. In second phase, we are increasing the progesterone dose. That is, it is a biphasic. If you see in triphasic, here we are also increasing the estrogen level. Okay, previously we are giving 35. If you see, we didn't change anywhere. But in triphasic, we will change the dose of estrogen also. Okay, that's why 35 to 50, then also 35. If you see here, non-ethindrone previously, first 6 days will give 0.5, then 6 to 11 days, 7 to 11 days will give 0.75. After 11 to 21 will give 1.125. Okay, that means here the dose will be gradually increasing. That is here two phasic and estrogen level also increasing. That way it is triphasic. There will be increasing level of estrogen, at the same time progesterone will be there. Progesterone will be continuously elevating. Estrogen first will elevate for 6 days, then will taper down the dose. Okay, that's why it is a triphasic. Okay, so this is the main difference. Monophasic there will be no alteration of estrogen progesterone. In biphasic there will be alteration of only progesterone level. That is first 10 days will be 0.5. After that one dose will be increased. Then in triphasic level, first estrogen will be given fixed 35 micrograms for 1 to 6 days. After that, estrogen level and progesterone level both will get increased. Okay, that means 7 to 11 days. After that, estrogen level will get decreased, but progesterone will get further increase. Okay, 0.7 to 0.125. Okay, so this is how we will call as a triphasic. The main mechanism action of drugs will be here is they suppress ovulation by inhibit the releasing of FSH and LH, because they suppress ovulation. Once, because how they suppress means they inhibit the releasing of FSH and LH. Obviously, when the FSH will be LH will get inhibited, obviously it will be inhibit ovulation. They will be acting as a production. Okay, that's why these drugs will be useful as a contraceptives. Next. Next important group drug will be postcoital or morning after pill. These are emergency contraceptive pills. Okay, in this high dose estrogen or high dose progesterone is effective in emergency contraceptive, because here we are giving you a high dose in of estrogen and progesterone. Like examples of LNG levonorgestrel, that will give 1.5 mg within 72 hours, or we can give ethylene estradiol 50 micrograms plus levonorgestrel 250 micrograms within 72 hours, or mifepristone. This is an anti-progesterone drug, 600 mg, very high dose. Within a single dose will given within 72 hours. Next, ulipristal. This is an SPRM. Okay, selective progesterone receptor modulator. 30 mg single dose within 5 days. That is within 120 hours. Or we can go with intrauterine devices within 5 days. Okay. How all this? If you see here, all the doses will be very high. Okay. How these drugs are will act? What the mechanism action means? These drugs will make endometrium prematurely into secretory phase. That means there will be two phases, right? Ovulatory, proliferatory, and secretory phase. When there will be prepone of secretory phase, obviously uterine secretions will become very thick. So when uterine secretions will be very thick, so what will happen? There will be unfavorable for sperm penetration. So once when sperm is not penetrate into uterus, obviously there will be no fertilization, no implantation. So it will be showing as a contraceptive effect. So that's why it will be enhanced uterine secretion. Thereby it will causes unfavorable for sperm penetration. Thereby it will be produced anti-fertility effect. Okay, that's all. Thank you.